about the diabetic clients now. I know that as personal trainers, it's really important for them to understand what diabetes is and how they can modify an exercise program, for a client who does have diabetes. But first, I want to know, what is the difference between type 1 and type 2?
Alright, so diabetes comes down to a little hormone called insulin. Insulin gets secreted by the beta cells in the pancreas, and it basically tells the cells to remove the blood glucose and take up the blood glucose to use it as a form of energy. Okay. So they have to inject it manually for their cells to take up the blood glucose. Alright. With type 2 diabetes, these individuals have insulin, but because of poor lifestyle choices, which includes poor dietary choices as well as inactivity and a sedentary lifestyle, can lead to the cells no longer responding to insulin. So the insulin gets secreted and knocks on the cell's doors, but the cells don't open for the insulin to enter.
Okay. Yeah, that sounds just as serious as type 1. Okay, so Dill, what kind of considerations do you have to take when training the diabetic client? I mean, is there a difference between considerations for type 1 and type 2, or do they both follow the same guidelines? What's the story?
They both have certain guidelines which will remain the same, and then there are one or two guidelines which will be individual to type 1 and type 2. One thing that will be the same right across the board is measuring your client's blood glucose levels before, during, and after training. And the reason for this is that your client with diabetes is prone to hyperglycemia and hypoglycemia. Hyperglycemia is when there's too much glucose in your blood. So signs of this would be, for example, the person's very thirsty, they have to go to the bathroom quite a lot, and it's a very serious condition. And the reason for that is a lot of blood glucose is toxic. Your body will start delving into its fats and its protein stores to generate energy, which will result in a large amount of ketones, which leads to something called ketoacidosis and can eventually lead to a diabetic coma, which could be fatal. So we really want to avoid this from occurring. Okay. The most common condition that you'll come across with diabetes is that we might go into a state of hypoglycemia.
Now that we're done talking about diabetes, clients who do have type 2 diabetes tend to have a bigger waist-to-hip ratio, which we know indicates health risks of specific health-related conditions and so on and so forth. So what modifications would you make if you did have an obese client in terms of exercise?
So progressing your program really slowly is very important, and this is important for two reasons. One is, of course, for compliance. If you're going to have a really, really hard program on the first day and kill your poor client, they probably will not come back. And this compliance you need to keep at the back of your head at all times when working with obese individuals. Secondly, they are very prone to overuse injuries and injuries in general, just because of the sheer size and weight that is placed on their joints. So progress it, even if it's starting with 5 minutes during the day, and slowly but surely progressing to a 60-minute session. The next thing that you need to keep in mind is with regards to your body composition measurements. Rather stay away from your body fat calipers as well as your bioelectrical impedance, and take circumference measurements. Body fat calipers and bioelectrical impedance will not be very accurate in this population, therefore the circumferences are preferred. And it also gives you a nice objective measurement to see slowly but surely whether your program is working or not.
I could also imagine that using skin foam calipers would be a little bit embarrassing for the obese client, depending on how morbidly obese they are. So I think that's also important to take into consideration when assessing your obese client.
Definitely. Other thing that you should consider as well is to take a multidimensional approach. So you want to involve the dietitian. The reason for this is that research has shown that an exercise program alone versus an exercise program with healthy dietary modifications is a lot more successful in weight reduction.
So when taking on the obese client, I mean, is it just the personal trainer involved, or are there other specialists who need to be involved, in trying to transform this client?
A multidimensional approach is always the best way. So you'll be incorporating or using other professionals as well, such as your dietitian, such as your psychologist, and of course the personal trainer. Also communicate with the dietitian and communicate with the psychologist how you can augment what they are doing with the client already. And yeah, it's the best way to go.
Yeah, I definitely agree that a psychologist would actually benefit, because we want to understand why they're struggling to either change, or why they get demotivated, and what triggers emotional eating. Is it boredom? Is it happiness? Is it anger? So I think behavioral change definitely comes way before diet.
Yeah, so we can call that step one of the program.
Definitely.
Then the last thing that you need to consider is screening. So this population generally has a lot of pre-existing conditions. For example, they may have diabetes, they may have hypertension, as well as dyslipidemia, and it just comes down to poor dietary choices and their poor lifestyle. So your screening is very important to ensure that you're still working within your scope of practice. So as a personal trainer, you are able to work with low and moderate risk individuals. A low risk is someone who's got one risk factor. Moderate risk is someone who's got two risk factors which are controlled. So if you've got someone who's obese and they have hypertension, or obese and they have diabetes, you're way to go. You can work with that person. But if you've got an individual who's obese with hypertension and diabetes, you have to refer.
Okay, yeah, that definitely makes a lot more sense. Just sounds a lot more serious when all three are combined. Now, my next question is exercise. What kind of exercises would you include? I mean, is it preferred to do more cardio training, or can you mix it up with resistance training? Is body weight training ideal? Tell me a little bit more about that.
Okay, so both cardio or aerobic training as well as resistance training is preferred. So you want to combine both forms. If we first talk about cardiovascular training, you can use different techniques. So you can start it off really slowly. So start off with continuous training at a heart rate between 60 to 70% of their maximum. And slowly progress to more high intensity interval type of training. But again, change it up and to keep it interesting so the person doesn't get bored.
Yeah.
And remember the first thing we talked about with regards to progression, so take it slow.
Yeah.
With regards to resistance training, body weight training is perfect. Be careful of their knees, because their knees, they are prone to something like patellofemoral pain syndrome or anterior knee pain. So careful of things like the lunges and the squats, but if it doesn't cause pain, then do them. If it does cause pain, then progress it slower.
Now, in terms of temperature, I know this is quite an important factor to point out. I know that obese clients, they tend to sweat more, so they're always expending a lot of energy. So during exercise, would it be wise for them to train in a hot environment, or how should the environment be? Should it be a cooler, a cold environment? What is preferred?
I can hear that you have trained obese clients before, Sarah. You are definitely correct. Environmental temperature needs to remain controlled. Therefore, training in a gym setting or where there's air conditioning, or training in the mornings and late afternoons is preferred. However, training in the middle of the day is not a very good idea with this population.
So Tyndall, you mentioned that thermoregulation gets impaired. Maybe just give me a reason why that happens.
So, Sarah, what is the primary role of adipose tissue or fat tissue?
Okay, well, I know that adipose tissue is beneficial for energy. Well, it's needed for energy, and you need it for insulation of organs.
There we go. So insulation, so it keeps heat inside of the body. So basically, with an obese individual, they are wrapped in a big blanket of adipose tissue, and this would prevent them from dissipating heat as well as somebody else would.
Oh, okay. Yeah, that makes sense. Thanks, Tyndall.